Welcome back to Between Two White Coats, a podcast designed to help you be the healthiest version of yourself. I'm Dr. Michelle Plaster, a family medicine doctor.
And I'm her co-host, Amber Foster, a family nurse practitioner. In our combined 30 years in medicine, we've seen a lot.
We're discussing key issues surrounding health and wellness, answering some of our biggest questions, overcoming health obstacles, and giving patient-centered advice in hopes of educating you and providing the tools you need to live a healthy life.
If you find our podcast helpful, please consider subscribing so you don't miss an episode. And don't forget to leave us a 5-star rating and review. This will help other people find our podcast.
Thanks for joining us. We look forward to serving you.
Hey, thank you for joining us today. Today's episode, we're going to talk about a healthy approach to a new year.
Wow.
I can't believe it.
It's like 2023.
Yeah. It's been a crazy few years, and so to say it's about to be 2023 blows my mind. My mind.
So we really want everyone to collectively take a moment and say, I have control over this year. I have the power to make changes that I wish to make. And what would those changes look like? You know, I think we're all on a hamster wheel. It's sort of the American way of life. And we're going so much that we haven't really taken time to choose our direction. So what direction do you want to go in this year? You have the power to decide that. And we want to just take this next 20, 25 minutes and help you explore what direction you want to go into this year and how are you going to get there.
Yeah, I think that we all start out the new year saying we're going to get our life together. I bought a new planner. It makes me excited. I buy highlighters and pens, and I got like the color code. I want to do all of it.
It's all blank.
It's blank. It looks beautiful,
scratch.
and then it doesn't really happen. But I think that we all say the very common ones, like I want to lose weight, I want to get my finances in order, I want to do, I want to accomplish some goal. But then we just say the things and we don't really have a plan for that.
Yeah,
so,
and the things are often like big results. So I want to get a new job. I want to reduce my stress. I want to feel better. I want to have more energy. And so you can't really like wish more energy into your life or it would have been here by now.
Yeah.
So we want to really pick that apart for you. And so, take a minute as you're listening here and think about, what do you want in this year? What is it that is the end result that you want to get to? And then we're going to take you through some steps of how you reverse engineer that and take it to what are doable things now that will get you to that end result as the year moves forward.
Yeah, we do weight loss management here at our clinic. So we see a big influx of patients typically in January for our weight loss. And a lot of times patients don't even know really what they want. They know they want to lose a bunch of weight, or it's never, I want to get healthy. It's always about pounds.
Yeah.
It's always about, which there's nothing wrong with that, because we're here to help them do that. But, a lot of times I don't hear, hey, I want to have increased energy, or I want to, it's usually a number.
Yeah, I want to lose 40 pounds.
Yes. And so when Shelly was talking earlier about like reverse engineering that type of plan, normally we'll sit down and say, okay, what are you doing now? So I think the first thing you have to do is say, okay, what changes do I possibly want to do? But what am I doing now about that? If you're not doing anything, we're starting from scratch.
Yeah.
So I would say initially think about things, but then create a goal. And if it is lose 50 pounds, let's work that backwards. So initially, like, one of the things you might want to do is check your diet. What are you eating? How are you eating? When are you eating? How is your movement? Are you exercising at all? Are you moving throughout the day? Do you have anyone to help you stay accountable? So that's one thing that we offer here is, you come in, we discuss weight loss stuff every month, but do you have anybody that would help you stay accountable to that?
Yeah, I think with any of your goals that you're setting, who's your team that's going to help you do this? I think we put ourselves on these islands and we say, I want to lose 40 pounds. How am I going to do that? We go to the things that we've tried before that maybe worked, but let's face it, if they worked long term, you wouldn't be trying to lose 40 pounds right now. Mm-hmm. And so we tend to go with what we've done or what we know, and that maybe hasn't served you in the past. So you may need to reach out to someone who's more of an expert in that area to help decide how you're going to do this. to meet you where you currently are and find the actionable items that you're going to take to get you to that end result of a 40-pound weight loss. Setting small goals,
Yeah.
asking yourself, am I 80% sure that I can do this? Because people will say, well, I'm going to start moving. So I'm going to get up at 4 a.m. and I'm going to exercise for an hour and a half every day because, gosh, wouldn't that get you results?
Yeah.
But are you 80% sure that you're getting up at 4 a.m. to
who likes
exercise?
4 a.m.?
Right. And for an hour and a half, that's a lot.
Yeah.
And so it is not a failure to say, I am 0% sure that I'm going to do that. And then step it back to what you will do. So I can get up at 6 a.m. and I can start with 20 minutes. And that's more than what you're doing now, and that's steps in the right direction. And you don't have to get to your goal next week. Just start doing the healthy things that you need to do to be moving towards your goal. Or looking at your diet, really picking it apart. We always have people say, well, I'm really not eating bad. Sit with a nutritionist, sit with your doctor, and look at what you're eating and figure out where the good is and where the not so good is, and what you can change, and then really make that into actionable items. So I'm going to cut out all of the sugary drinks, and maybe you have to wean back on those little by little, or maybe you just cold turkey and say no soda, no sweet teas, no Kool-Aids, no juices. I'm just cutting out the sugary drinks, and I'm going to do that for a couple weeks, and then when that feels pretty natural, I'm going to go on to the next thing, and I'm going to cut out the fast food. I'll do fast food once a week. That's down from 4 times a week. That's improvement. That's doable. I'm 80% sure that I could eat fast food only 1 time a week. So it's really about making something that's measurable, then defining for yourself the when, the where, the how, the who. And so I'm terrible at exercising. Do I need an accountability partner? I'm going to call my friend who's also trying to exercise and say, I'm going to meet you at the park. We're going to walk and talk 3 times a week. You'll know that I'm not there. And so setting these kind of things up that are actions in the right direction will get you to the 40 pounds. But what does 40-pound weight loss look like? That is not an action. No. That is an end result.
Yes.
So the first thing you have to do is really take your end result and turn it into the actions that will get you to your end result.
We know that even for things like weight loss, but other things like your mental health, or it has to be something sustainable. So if you're going, let's take the whole year and break that up and say, okay, one of the things that we advocate for is mental health and making sure you're reducing stress. And sometimes that's, if your stress levels are crazy high, to remove everything at once, that's not actionable either. Like,
right.
Maybe you need to see a therapist. Maybe you need to talk to your family about things that are stressing you out. Like, hey, I could have some help with someone taking out the trash. Like something small, but it's super stressing you out because you're worried about trash day or something. Like just breaking those things down to say, hey, this is where I'm at. This is where I want to be. And then just the small things in between.
Yeah, we would start by saying what stresses you.
Mm-hmm.
If you're saying, I want to reduce my stress, what stresses you? Well, it stresses me that I'm overburdened, that I have way too many things to do. So then dig in and say, well, what really doesn't need to be done? Mm-hmm. Maybe your kid's on 3 teams and that's just too much. And you have to cut it back to 2 teams. Mm-hmm. And you're not a bad parent if your kid is only on 2 travel teams. Or not on a travel team at all because it's financially difficult and we don't have the time for it. It's cutting into other things that matter. Maybe what stresses you are certain people in your life, and you have to create some boundaries around some relationships. And you have to identify those relationships that are not of service to you, and how are you going to create some boundaries there? And if I say create boundaries, and you're saying, I have no idea what you're saying or what that looks like or how to do it, there are health and wellness coaches, there are mental health professionals that can help teach you what a boundary looks like and how to protect and sustain that boundary. There are many resources that you can tap into to look at how to reduce your day-to-day stress and learn new skills and actionable things that you can be doing that will reduce your stress. Or maybe your life, you say, I really don't know where I can remove things, and I've removed the things that I could, And so you just need to do some things like improve your sleep and get more activity to release those endorphins. Pray, meditate, do yoga, whatever it is that really carves out that little stress reduction time of daily activity, where you say, for the next 30 minutes, my focus is working on reducing my stress, managing what's going on in my brain a little bit better, or getting better sleep, whatever it may be that you identify. Reduced stress is a huge, important thing that we all could do a better job with. Yeah. But what does that look like? What are the action steps? What can you identify that stresses you or makes things feel overwhelming in your life? And then how do you step back and say, okay, I need to change that. What does changing that look like? And if you're saying, I can't change it, I bet you can. Yeah. You just need someone else to help you figure out how.
Being objective, sometimes listening to other people, if you're saying something, they can be like, well, no, you can do that. Like, sometimes you just feel overwhelmed when it's your life and your stuff.
Yeah.
But talking with someone, a friend, a counselor, someone that can be objective is always helpful.
It is so common to not be able to see the solution.
Yeah.
Because let's face it, if it was an obvious and easy solution, this would not be a
We'd
goal
have it all
that
figured out.
Yeah, this would not be a goal that you have not reached yet. You would have reached this goal if it was something that was easy and obvious. So having someone help you to figure out how you're going to do this, what steps you're going to take to do it, I think is one of the better things you could start the year with, so that you really have well defined what you're going to do.
Yeah. One of the things that you were saying, we've talked about it in previous episodes, you tend to call it the pillars of health, but the sleep, managing stress, movement, and nutrition.
Yeah.
So those are great places to start if you're unsure of, I don't really know what I want to do. Like, I've never really set a goal for myself, or, I always break my New Year's resolutions. And instead of doing that, saying, okay, how can I improve at least just those 4? Like, that gives you some great starting points.
Yeah. So for a healthy approach to this year, you really can look at those 4 things and choose one, choose a couple. Don't overwhelm yourself.
You could do one a quarter.
You could do one a quarter.
Look at that.
Yeah, see how it breaks into 4 things throughout the year. And really digging into those things. Maybe you say, well, sleep is great. I don't have any issues with sleep. My sleep time is protected. I get 8 hours. And so check, good, wonderful. Protect that, keep that the same. And then ask yourself, well, how's my stress management? Ask yourself, how is your nutrition? What are you eating? Are you fueling yourself with what you need for best health, best energy to feel good throughout the day, but also to feel good in the years to come? And are you moving? You may, as you're digging through those things, if you have certain disease states, certain diagnoses, prescriptions that you're taking for particular things, ask yourself, okay, well, I have high blood pressure. So what would nutrition for high blood pressure look like? Mm-hmm. Let me look at the American Heart Association's website and get some clear recommendations.
And people, they Google all the things. So I know you can Google that. Like, that takes 2 seconds on the Google.
Yes, diet to reduce your blood pressure.
Yeah.
Diet to reduce your sugar levels for diabetes. And there's some really reliable, if it's the American Association of, it's typically a good. So American Diabetes Association, American Heart Association. The Mayo Clinic has a lot of great stuff out there. These are all good, reliable resources. Your neighbor's blog, maybe not. If your neighbor is medically trained and is doing a good job, but everyone has,
most local health departments, most hospital facilities have some sort of nutrition classes, and a lot of those are free.
Yeah, absolutely. And so looking for those community resources. Different things you can jump into to get more information, reliable resources are really important. So you can start with how to have a healthy new year with those 4 pillars of health. And if there's any area that really stands out to you and you're struggling with, of course, we always advise to consult your primary care person. I mean, we talk to your doctor, talk to your nurse practitioner, PA, and see if they can give you some guidance on how to help you with those things too. Other things that are going to keep you healthy in this next year.
I know this is going to be a big surprise for everyone when we say this.
Get your annual wellness
exam
visit.
Come on. Well, who would we be if we didn't say that?
Yeah. I mean, we have to convince people of the importance of this visit all the time.
I have to convince it for myself. I mean, we're here in the clinic, so I'm seeing patients, and I have to make my own appointment to see one of our providers, because I'm seeing patients all day long, so I'm busy, but I'm here.
Right. Yes, it is incredible that we have to check these boxes and do all these things too. You can reference into our Preventive Health at All Ages podcast episode where we let you know at this age, these are all the preventive things you should be doing. So, I'm blessed with colonoscopy now because I've turned 50.
Yeah.
We have great gifts for you at all these ages. Whether
I turned 40 this year, so I've got my mammogram.
Happy mammograms.
I know.
So it is truly a lot of different things that you want to make sure you're doing because these are the things that allow you to stay healthy. It is so much easier to prevent illness than to try to find your way back after you've become sick.
And I think that too, like one of the things I've seen from primary care standpoint is find a provider that you like. Like that you have good rapport with, because even if you are coming for once a year wellness, like there's a pattern to things. And so sometimes blood work, like we can see slowly that your cholesterol is creeping up.
So let's talk about the blood work that you and I talked about yesterday.
Yeah.
Wonderful family came in with 2 healthy kids. They are super active, thin. And mom has 0 complaints, but mom's on the ball and she says, I want to make sure that they just get their annual wellness every year and it's time for that. And so, and can we get some blood work? I just want to make sure everything's okay. And so the little healthy one with 0 complaints has a sugar of 335. And so I said, okay, this isn't normal, but maybe she just loaded up on Skittles right before she came in. Can you come right back in and let's get a 3-month sugar average, which is also elevated. And so our little 9-year-old has type 1 diabetes. And we were able to catch that because mom brought her in for an annual wellness before she even got sick from it, before she ended up in the hospital or could have potentially died from unknown, undiagnosed, untreated type 1 diabetes with those sugars that quickly would have crept higher and higher. And that was just come and get your annual wellness. Look how we could prevent something horrible from happening. So we definitely, get your annual wellness and get those regular labs, know your numbers.
Yeah.
So if you don't know what your blood pressure tends to be, if you don't know your cholesterol level, whether your sugar was okay, these are things you need to know about yourself. Empower yourself to know that you're healthy. To have those conversations with your healthcare provider to say, I want to make sure my sugar, my kidneys, my liver, my cholesterol is all where it needs to be. And so it's just that once a year pop in, 1 hour in a doctor's office can make a huge difference in keeping you healthy. Yeah. So you're going to hear us say a million times,
all the time,
because the things that we find on those annual wellness and the things that we're able to prevent and the lives that are saved because of doing those annual wellness visits, we see it every single week, and we have for our entire careers. So we continue to put a lot of weight into that because that's where we catch things early.
Well, and I will sometimes say, because those typically are covered by your health insurance, and so that's a $0 copay to you.
Part of the Affordable Care Act was to put an emphasis on 100% coverage on preventive
care.
And so do your preventive stuff. Yeah. You're paying for this insurance,
yes.
people. Get the most you can
yes.
out of it. It's not cheap.
Yes.
Yes, and so doing those things, if you're insured, that often is
and if you're
zero
not,
cost to you.
Yeah, if you're not, there are free clinics. There's one here locally, and I know of a couple in surrounding counties. The health department, they can do blood work, so those are great resources as well.
Absolutely. So knowing your numbers, getting your annual wellness visit, looking at the kind of foundation of health and making sure that you're doing those regular things will all help you with a healthy approach to the new year.
One thing I didn't say, because we were talking, you talked about insured, and then I mentioned the free stuff. But we also, a lot of places also offer self-pay rates. So we do that here. So sometimes, like if you don't have insurance, and you're like, I don't even know, I feel like that would be really expensive. We have self-pay rates that are pretty affordable for patients to be able to come in and see us, plus the blood work. So if you're somewhere that you're like, I don't have insurance, or I am underinsured,
and call
ask,
and say, if I'm paying cash, and cash means credit card, check, whatever. You tell how old I am. I said check. But call the imaging center and say, I need a mammogram. I don't have insurance.
Yeah.
And they'll let you know, hey, we do a promotion in October and it's this price. Or if you're paying cash on the time that you come in, it's reduced down to this price. So sometimes if you're discouraged at the advertised price of things or what's billed to insurance, there are self-pay discounts, uninsured discounts that you don't need to not stay up on things because of cost. If you dig and ask, you can find some good things. So Amber, let's be a little bit vulnerable and talk about our healthy approach to the new year. What is it that we're going to do or that we're digging in on?
I mentioned we were kind of talking this over earlier, but I am personally in a stage of life like my kids are busy. My son got his permit, and if you want to know about anxiety that I never thought I mean, I'm not an anxious person, but oh my goodness, he thinks yield signs are optional and stop signs are as well, and I'm like, like oh my
that
goodness.
octagon means something.
I know, please stop. It's red, but anyway, so like I have a new driver. We're teaching, and I've only ridden with him once, but that's hopefully his dad will teach him. And and then I have a daughter that's about to be a teenager, so we're doing all of those types of things.
Yeah.
But contentment, I've said it a million times. I've said it with my children. Like, we are so blessed, and we really do have we have a good life. Most of us do. Like, there are things that are hard. We've both been through really difficult things in our families over the last few years, and so sometimes just getting down to the basics reminds you truly how grateful you are. And so I really have been kind of convicted over contentment. Like, let's just be happy where we are. Let's be thankful for the thing. Dear Lord, I'm about to cry. Let's be thankful for the things that.
So how do we work that backwards? We want to be more content in this year. How do we work that backwards? What does that look like in day-to-day activity?
Help me with this. So, I mean,
I'm going to say gratitude.
I know.
I love gratitude.
Like, thank you, Lord, and being I'm a Christian, so I'm a believer, and so for me, that's me being centered in my faith, being grateful and thankful for things. And sometimes I want to be like, oh my goodness, I have to drive these children everywhere, but I get to do that. Like,
and
that's
these could be simple things where you say, when we're in the car together, we are all going to list off something good that happened today and something that we're thankful for.
Yeah, usually it's my kids are fighting and I'm like, all right, name 10 things that are nice about each other, and they're like, oh, your face is great, or dumb things like that. But sometimes it's just like, let's be thankful, let's be grateful, and how can we incorporate that? So car rides are a good one because we're in the car a lot.
Yeah, or making
I might be saying that more because he's driving too, but
yeah, right. Let me list off what I'm thankful for.
Lord, I'm thankful for everything.
Or maybe getting back to making sure that we say a prayer before dinner, or we say a nighttime prayer together. If praying is a way that you find yourself centered, or maybe you get back to saying, okay, because I know you're a go person, and so you say, okay, I'm gonna slow down a little bit and do like a 20-minute meditation, or
even like just being home and enjoying time together.
Yeah, carving out that little family
time.
We're all running in different directions, but every single week, this time, we all go together and we're going to go to a movie, or we're going to sit together and play a board game.
Yeah, we used to do foster family fun nights when they were little, and I used to try to fun things.
So Amber's last name is Foster. Yeah. She's not talking about fostering children.
Yes. Yeah. Even though sometimes I feel like I do that with all their friends, and I love it. But I used to do foster family fun nights, and so when they were little, and we would make a big thing about it, and then we got busy. So maybe do some things like that.
Pull that back.
Yeah.
Why does foster family fun night ever have to go away?
I know.
Yeah.
We have to bring that sucker back.
And so, my New Year healthy approach is, I'll be extremely forthcoming with this. I am in the smack throes of menopause, and that is not a fun place to be.
Yes, and I'm certified, remember? So
yes, and Amber does hormone replacement therapy. And I'll tell you, for 6 months, I've been saying, I work in a place that draws blood, and I am there every single day, and I have not had my blood drawn. So I am committed to getting my hormone levels done, to getting on hormone replacement therapy. I have no contraindication to that, and I think it's going to make a huge improvement, and I'm going to get started on that. And I'm going to continue to work on my mental health so that I am doing my regular activity. Also, as I'm going through menopause, I realize, being medical, that I'm losing bone mass, and I'm losing muscle. There are other things that my hormones were doing for me that will be missed.
Yes.
And so I'm going to make sure that I'm exercising regularly. I'm going to put that on a calendar, ask myself, what is the amount of time that I can do where I'm not going to beat myself up because I didn't meet my goal? So I know I can get in 4 days a week. I'm just going to commit to 30 minutes. If I do more, then that's a bonus, and I'll feel good about it. So I'm going to get my exercise. I do a lot of gratitude stuff. I'm going to make sure I'm carving out before I go to bed. I'm going to do 3 things I'm thankful for.
We're going to pray that your dog sleeps through the night.
Yes, because our family added a puppy, and that was a great idea, which was my idea. And so I'm going to need to get back to the pillar of sleep. It's highly dependent on the puppy. But I'm really going to, I've known that menopause menopause is something that's pushing me in a place that I'm not comfortable being. So I'm going to really address the menopause, and what that looks like in daily activities is getting on the hormones that I need, getting regular exercise, and really looking at my symptoms and how I feel and making sure that I get the help that I need. So if I am not feeling better, I'm going to consult a trusted colleague and get more information on what I may need to do. So, us, like all of you, just because we work in healthcare, it doesn't mean we practice
we're not the
healthcare.
best patients sometimes.
And so us, like you, are going to really take a moment and say, what do we want this year to look like? We are recognizing that this year is not going to be in our control if we don't take control. We can have another year that just flies past us and we're not quite sure what happened, how it happened, or how intentional we were about any of it. So I am really promising myself I'm going to be intentional about this year. I'm going to define what's wrong and define how to fix it and get help on how to fix it if I can't find that definition and that solution myself. We like to end you on a good note. Today's Tell Me Something Good is water. It's easy to access, it's a simple idea, but it is the most important thing to keep your body healthy. So make sure that you're drinking enough water, substitute out some of those less healthy things that you're drinking for water, and know that you've done something good for your body while you drink your water. Thank you for joining us, and until next time, take care of yourself.